Steve Smith, CEO of Airlink, and thank you for joining me for this podcast show. As we develop the program over the coming weeks and months ahead, we hope to deliver insight, guidance, lessons in best practice, and while highlighting innovation in the humanitarian response and logistics space. My guest today holds a degree in chemical engineering and honed his leadership skills at Johnson & Johnson, where from 1988 to 2011, he served in a number of senior leadership positions, including Vice President of Global Operations for the anesthetic medicine business, and for a time was also Director of Asia Pacific Operations in Shanghai, which is interesting for our conversation today around COVID-19. He joined MedShare as Chief Operating Officer in 2012, and just 2 years later was named President and CEO. And as MedShare CEO, has received considerable and well-deserved accolades for his leadership in responding to the 2014 and 15 Ebola crisis. I'm delighted to welcome Charles Redding. Thanks so much for joining us, Charles. It's good to see you.
Yeah, thank you, Steve. Thanks for having me.
Great. Now, I should declare a little interest before we go any further. MedShare and Airlink have been partners on many missions over the years, including the Ebola responses in 2014 and 15. And in fact, just a few weeks ago with United Airlines and flexport.org, we even delivered 50,000 masks to healthcare workers in New York and New Jersey. And so it's really great to have you here, Charles. Let me start by asking you, if you would, just to give a quick overview of MedShare and what you do, just in case our listeners are unfamiliar with your organization.
Yeah, thank you. Thanks again, Steve. So again, I'm Charles Redding, the President and CEO of MedShare. And for those who aren't aware, MedShare, we are a 501c3 nonprofit humanitarian organization. Our mission is simple. It is to improve the quality of life of both people and our planet. And we execute this via a series of programs. We have a program centered around maternal child health, primary care, disaster relief, which we'll talk a little bit more about. Also, infection disease and control, which is geared toward helping the health system prepare for pandemics like the one we find ourselves faced with now. And we also do, as part of our sustainability, we offer biomed engineering training and support. So that's MedShare. And just a little bit about our model. We spend the bulk of the year collecting surplus medical supplies and equipment that we redeploy to impoverished communities around the world, including here in the U.S. And so we collect upwards of probably 2.5 million pounds of items that in some cases may have ended up in landfill, and we repurpose it to save lives. So that's MedShare.
Yeah. Well, that's a great program. And, it's you guys do a lot of good work. One of the things I'm interested in, though, we're all living, in the current new normal COVID-19 environment. And it's really sort of changed many of the fundamental assumptions that, CEOs and including those of us that lead NGOs are working by. And so can you tell me a little bit about some of the biggest issues that MedShare is facing around your operations today?
Yeah, sure, Steve. I mean, obviously we have a program geared toward disaster relief, but typically we're not a part of that disaster relief. So, we find ourselves, right in the middle of the storm and having to adapt, if you will, to some of the same things that typically the countries we're serving are having to deal with. So it's been a significant business disruption, for us. So the challenge for my organization is, how do we continue to protect the well-being and safety of our staff at the same time we continue the execution of our mission? Because this is why we exist. There are a number of countries that continue to depend on the work, the services, the programs that we offer. So it's been a real balancing act for MedShare. But again, we've done it. We continue to do it. And we want to be there for those communities that really need us most at this time.
Yeah, it's very challenging, right? Because in most of the responses, even we see this. Most of the time you're focused on a specific group of individuals that have been impacted somewhere else, right. And that's certainly the case. Certainly coming down the road for sure, but it's also impacting us and our teams directly, which is one of the big unique things, huh?
Yeah, it really is, and more specifically, it's impacting us here in the United States. So oftentimes, I would say our mission is probably executed. 90% of it is international, and maybe 10% in the U.S. And we really had to flip our model. I mean, because right now the U.S. being right in the middle of that storm, we hear the escalation of the cases, the deaths associated with it. So our model was very flexible that we could do and turn it and begin to provide these PPEs to local hospitals, local health systems, local clinics, local shelters. So the same services and program we typically would provide internationally, we find ourselves doing it at home. So that's been rewarding for us to be in a position to do that, but also speaks to the time, that we're in. This pandemic, it knows no borders. It is impacting everyone equally, and we want to make sure that we can support whoever needs the help.
Yeah. Yeah, you're right. And so, and you guys do some great work for sure. But I guess, one thing I'm interested in, over the next sort of 3 to 9 months, operationally, you said, most of your operations would be international. What do you see some of the challenges, and what are your thoughts on your approach over the coming sort of 3 to 9 months through the end of the year?
Yeah, I mean, Steve, no doubt it's going to be a new normal, not just for the world, but also for us, the NGO community. Some of the things one of the things we use 20,000 volunteers a year to execute our mission. They come in and volunteer. So obviously there's some things we're going to have to do different around social distancing for the volunteers. It may lead us to limit the number. I think providing, some basic PPE in the workplace is going to continue. We've kind of gotten used to this remote work force and showed that it can be done. So I think those are some of the things that we would probably, but over the 369, the things that I worry about, because of the economic downturn that's projected, our business, we exist based on fundraising and the generosity of our supporters. And things are going well now because there's, a tendency for people to want to do things in the moment and really support our response. But what happens after the response? What happens when we start to go back to the new normal and people look up, they don't have the same, discretionary income. What impact is it on the markets? So those are the things that could potentially impact our ability to get funds to continue to execute, our mission. So those things worry us. But again, I think most people try to guess and anticipate what's going to happen. No one really knows. But I do think, one of the other things we do, we usually have large events. We cancel events. It's just not something we want to do. So, and, as a staff, as a board, we continue to evaluate, what is the impact to our business and what things we should, start to do differently. But that's just a few of the things we discuss with our model.
Yeah, I mean, the entire sort of humanitarian sector is somewhat on its head a little bit right now, right? Because they're all being affected so heavily at their home base.
They are, but I think it also highlights the need for them, and that, there's a lot of NGOs, not just MedShare, that's really stepping up at this moment. You hear the governments in some cases struggling to get the items to the people that need it, and then step these NGOs that are very nimble. Their models are very flexible, and they're providing a level of support. Quite frankly, if they weren't, it would be even more catastrophic than what you hear in the news. So, my hat and my heart goes out to all the NGOs that are responding, working to protect our first line workers. And we've gotten a lot of great notes and appreciation for the work we're doing. But again, we're not alone. Organizations like yours who are making sure that things can get to the people that need it. It's really highlight the need for the NGOs and the services we're providing.
Yeah, and we're happy to do it. That's great. I agree. Yeah, there's some great examples out there. Actually, kind of leads me into my next question is, as a leader of MedShare, I mean, what are you most proud of, within your organization at this sort of difficult time?
Yeah, I mean, just a little precursor to that. So MedShare, we've got 3 operating sites here in the U.S. So, we're headquartered in the Atlanta area, but we're also in the New York metropolitan area as well as the San Francisco Bay Area. So I bring that up to say, those are 3 very prominent areas that have been impacted, by this pandemic. So what I'm most proud of is really the resilience of my staff. I mean, because they're personally impacted being in these regions. But at the same time, I see them, really caring for others. They showing up for work, every day, not being able to take all the time off that we hear, others are doing, that are doing their part, quite frankly, to flatten the curve. So we're very appreciative of that. But, being essential business and being in a position to provide the critical personal protective equipment that we know the frontline health workers need, I've just been proud. And we've, like I said, we received a lot of thank you notes from hospitals, from shelters, from clinics. And I give all the credit to my staff because they keep showing up, and they've got, their families are being impacted. They've got kids out of school, they're balancing, work and family. Yes. But at the same time, they recognize there are those that are dependent on us. And so that's really what I'm most proud of, Steve.
Yeah, no, that's great. That's great. I mean, yeah, it is funny how, having the kids, I can't remember the video where the guy was being interviewed and he had his kids run in into his office. And that was a big funny video. That seems like it's every day right now, on these conference calls. And so I think we're rallying and pivoting on that. So, so I mean, related to some of the things that you've already said, I mean, I think there are tremendous things, as you rightfully state, that NGOs are doing, and not just NGOs, but governments all around the world. But many response organizations, have not been so fortunate, and some of them have pulled back their teams, they've closed programs, they've reduced staff, and it's really been a really challenging situation for some, given their model. In the context of what we're talking about, what does the new normal look like in terms of the future, and even could be the remainder of this year and then into next year? What do you think that looks like from your perspective?
Yeah, you've heard the adage that necessity is the motherhood of invention, right? In terms of if you need something, you usually come up with an idea. So it's forced us to reevaluate, some of our service delivery. For example, we typically ship things out. One of the things we've done is to start invite teams in, meaning, every Friday we have a community service day in which we invite, 10 to 15 area-based, community-based safety net clinics, free clinics, shelters to come by and pick up PPE, right? So they come by. We've got our gloves, we have our mask on, and we pop the trunks and we put, product in there. So that's new for us, but it's something that I think we're going to adopt moving forward because it really has maximized the effectiveness and the efficiency of our ability to provide those types of services. The other thing I mentioned is it really forced us to focus on the U.S., probably larger than what we typically would thought. And so that's something we want to build upon. We've created some key partnership with hospitals. They know who we are. They know what we can do. So that's really great. And I think this technology, the use of technology is something that is front and center with much organizations. You find board meetings being conducted via Zoom, right? You find that people can work remotely, and it's highlighted some deficiencies in some of our technology that we've had to, reach out and upgrade to make sure we could, sustain, those types of things. But make no doubt, Steve, it's going to be a very different world. I think it would be, a fool's error to think that we can just go back completely the way we were. I think we're going to have to adopt a new normal. But the key for MedShare has been the flexibility of our model. Models can't be rigid, that they can only be executed one way. And so, multiple execution platforms, if you will, for our model has been key to our success. We've used, most of our, the other thing for us, and this is where you've come in quite significant for us, typically our shipments are via ocean freight, so 15 to 30 day kind of, chucking on the water, and it gets there and it helps strengthen these communities. But in this moment, you need more real-time delivery. And so having, partners like yourself that can really work with us to make sure we can get things there a lot quicker, it's just been paramount of importance and significance for us and our ability to provide the level of response that we have. So
Yeah.
Those are just some ideas. I'm sure there's more, but
sure.
it's definitely not going to be back to business, as usual.
Yeah, understood. And similar for Airlink, with our support base being aviation, and speaking with lots of partners, there's certainly many airplanes available right now because they're not being flown, and there's a lot of creativity and a lot of very generosity. But the aviation sector is really having some tough times itself. That's very clear. And so that's sort of challenging. Well, we recently, at my opener, I mentioned that we recently worked together with on a shipment of some masks to New York and New Jersey, one of your sort of key hubs. And we worked with United Airlines and our good friends at flexport.org. And neither of those organizations charged any fees at all, which is great. And while it's a modest, sort of shipment size, I think it's a great example of collaboration. Looking sort of, relative to sort of the intersection between MedShare and Airlink, and talking about the global airline sector or the aviation sector, what role do you think that there is that they could play over the coming weeks and months? Dare I even say years, to help, in COVID-19 response and also future new norm.
Yeah, I mean that's a great example. If I can just dive a little bit more into it, it's collaboration and powerful partnership. So just to paint for the listeners what happened there. So these were K95 masks that were purchased in China by Flexport, right? Yes. Donated to MedShare, and then MedShare connecting with Airlink, and via Airlink, United Airlines were selected to fly these products up to New York metropolitan area, where then it was distributed to some hospitals. So that, and as you said, all free of charge. And so I think that role, we've often talked about this, how do you make sure that airplanes are always flying with full cargo space, for example, whether it be backhauling, using that for humanitarian aid purposes and things of that nature. It's going to be, key role, because I mean, maybe we don't have the same number of flights anymore. Maybe there's social distancing on flight, but I think where we can continue to maximize is that cargo, delivery of cargo, and helping us get things, to where we need them expeditiously. So that's what I mean. And one of the things that's forced me, maybe I should rethink my model around how we ship. Maybe it should be more air shipment and maximize our impact with those as opposed to just the containers. So it's a balance, right? We've always said, well, we can get more volume, but, with the speed and the various routes that we have, I just see the airlines playing a key role in that delivery of humanitarian aid, but also the insights you have into those local communities, right? Because anywhere you have familiarity, you're in a position to help share with us kind of what's happening, on the ground, and being that sort of conduit, if you will, of information for us.
Yeah, that's interesting. Yeah, I mean, I suppose that one of the governing factors here is that these supplies just aren't available, and so even though it might be more cost effective and more efficient on many levels to put it on the ocean, it's cheaper. The time it takes, but it's not just the time it takes, they're just not available. And so things are sort of almost being manufactured just in time. And so that's because there's such a massive demand, and the supplies just aren't there. So it's kind of an interesting balance whereby absolutely flying it by air is a tremendous cost. It's very expensive to fly an airplane. But at the same time, you don't have the time. Huh?
Yeah, and this is one of the key lessons learned, Steve, we had from Ebola. It was that you have to focus on preparedness and readiness and not just response. And so one of the reasons that MedShare's had so much of the PPE is because we had it beforehand. We had it before the crisis. We had partners that understood it was important to pre-position, partners like Henry Schein and Amundsen and some of these big producers of masks. They were working with us ahead of time. I mean, we've got stockpiles from the last H1N1 outbreak, right? that they had excess. So we're always looking for that to bring in to make sure we pre-position this product so we can respond rapidly, right? So you need to, in addition to the logistics channel, whether it be through ocean freight, airlines, or whatever, you need the product availability, like you said. And so, and so we've been fortunate to intersect those two. We have the product, and then we have the partners that can get it there, and that together leads to greater impact. And that's what we've been able to do. So, unlike some of our other NGOs, they want to help, but they just can't get the product. I mean, demand is just so great at this time. You just can't get it. And so we were fortunate in that regard as well.
Yeah, that's great. That's great. And you mentioned a little bit about Ebola, and you yourself and your organization received a lot of great accolades and praise, and rightfully so. We were proud to also work with you and help you connect with the aviation sector to move supplies into West Africa, 2014, 2015. What was it that you did? Maybe tell me for a minute that was innovative, and how do you see that sort of affecting your operations going forward as things move from maybe the northern hemisphere to more fragile communities around the world?
Yeah, no, great question. I think one of the things which really helped us is having a disaster response protocol that we developed, which governed, when and how and if we would respond at all. And so, and a lot of that was just based on, did we have existing relationships? So, having already had working relationships with Liberia, with Guinea, with Sierra Leone, it became a lot easier for us to reach out to friends, if you will, to see what type of help. And so very quickly being able to pull together a needs list, a very specific needs list, as opposed to us just collecting things. So we had that early on in terms of what we need. The second thing was having built up this collaboration of partners that understood we had that as a program. So they were giving us these things ahead of time, and as we developed the needs list, we can very quickly get that out to them, and they responded, in a bigger way. And then I think lastly, I always talk about these public-private, kind of partnerships and working with the civil society or governments. That all came together. We were able to work directly with the Minister of Health. We would work directly with private-based companies. We worked with your organizations like yourself to get things there. And so, and we have an ongoing monitoring of these types of events. So we're usually, at the early stages. So we saw this coming probably before a lot of the other organizations. And so we started our dialogue quite early on. And I've had the opportunity to go back to Liberia since the Ebola outbreak, just to see how things were going. And it was just an outpouring of generosity to them with the understanding of what we had tried to do and partner with them. But I very quickly moved the discussion to one of, okay, how do you prepare for the next? It wasn't a question of if, but when. And now they find themselves, because their systems are so fragile, to your point. You think it's an issue in the U.S. When it hits these developing countries where the health systems are so weakened to begin with, it could lead to, literally catastrophic results. And so that's why a lot of our focus is helping them strengthen their health systems early on. And their needs are going to extend far beyond just personal protective equipment. They're going to continue to need basic supplies, general supplies, a lot of things, because what they're finding as patients come into the hospitals for COVID-19 related issues, they're presenting with other issues, right? They see the underlying issues that have gone untreated, and so they're having to treat those in addition to, what they find with COVID. So Ebola, it was a great example, again, of these partnerships, but also the need to help strengthen these communities. But also out of that, and I continue to say this, is that whenever you have these global outbreaks, they require global response. You cannot look at these things and hear they're happening and just say it's happening over there, because it will be here before you know it. And you saw that happen here with COVID-19. A lot of the focus early on, and rightfully so, was on China. Little thought or consideration, or in some cases even preparation, that it was coming here. And I think we've got to think about that. And that's why I think the global response is what you needed, to try to attack it at the source, if you will, if you can. And then as it migrates, you've got to be flexible to do it, to attack it as well. So, and those are all key lessons I felt made us, I hate to use the word successful, but at least allowed us to make a greater impact in supporting those countries that were battling that devastating disease. And we find ourselves, in the middle of a pandemic now, also.
Yeah. Yeah, I guess that's right. I remember of all the shipments we did, many shipments to West Africa just to combat Ebola. It did change from protective gear to general other medical support, because as the healthcare systems go down, so does everything else. It's not just then about moving protective gear and ultimately sort of vaccines. It was, other drugs or other medicines that were needed for other things, because the whole healthcare system's gone down.
That's correct.
Yeah. And so, you've mentioned about how there's, a key need between NGOs, private sector, governments to working together. And I think even in an interview in 2016, you had referenced that this was critical. It's very challenging today because everybody's affected by it. There's a massive amount of media coverage every day, some for better or for worse. Are you optimistic we can do this?
I am, but it's going to take a spirit of collaboration, teamwork, and you remember I think it was from the Churchill, who said, "It's amazing what you can get through if you don't worry about the credit," right? And so I think as we continue to work these things, we've even, everybody wants to measure, monitor, and evaluate effectiveness, and I'm into this sort of collective impact, right? It's no one group that can impact it alone when you're talking about these large, complex health systems. But I think if you start focusing on collective impact, we've got great examples of this. We've got a project, for example, in Nigeria now, where we partner with Coca-Cola Company and the Ministry of Health of Nigeria to improve maternal-child health outcomes, right? And so you've got Ministry of Health saying, well, if you upgrade the maternity wards in these 15 large hospitals, then we can do it, and Coke provided funding. So those are the collaborations, and MedShare came in and said, okay, we can provide the equipment, the training. And those are the partnerships I'm talking about. And so now we can measure the collective impact. So the Minister of Health can talk about the impact now on all his Millennium Development Goals in terms of improving it. Coke can talk about the wonderful work that they were able to do and give it back to the community. And MedShare was able to, measure the effectiveness of our program. So I just think it's going to take a lot more of that. And what I've also found is that, particularly when corporations are involved, it's much easier for them to deal with an NGO than direct government, right? Because you get into all the issues, conflict of interest. So I think of that intermediary position that NGOs can often play, and pulling those both parties together can lead to a model. So you asked me if I'm optimistic. I think it is. I think I am. I know I am, because issues like what we're faced today, and you can see the fragmentation that can exist within government systems, and you understand the gaps that are in health systems. I just wrote a column for the supporter report, which I talk about the safety net clinics being an essential part of the health system, because these are the ones, they're addressing a lot of these marginalized communities that we often talk about, that, they're uninsured, so they're not in the hospitals, and they still need health care. And so all of that is part of that health system, and everyone is playing a key role. So it just underscores the need for more of that to happen.
Yeah, that's important. I appreciate your time today. I mean, let's try so as to end on a positive note, because I know you're an eternal optimist, I'm sure. But there's a lot of people that are in a difficult situation right now. It doesn't matter where you live. And everything's changing, lots of people hurting, economic situation uncertain, and I think you've mentioned a couple of things, but what are your sort of leaving thoughts or departing thoughts? What do we have to feel optimistic about?
Yeah, I think there's a lot. I mean, you heard people say we're all in this together. I really believe that, and I really feel that. And I think one group in particular I want to call out because they don't always get the credit that they deserve, and that's our millennials. The millennials, I think the fact that they're doing a lot of the social distancing, the quarantine, not just for themselves, but for others, speaks to their care. So I'm very optimistic about that. And it's all the disruptions you've had in the school systems and the normal way of life. And people, for the most part, are really just, bearing with it, understanding that they need to do their part, that it's not just about them. I think it's very encouraging to me. And the language, one of the things I'm very proud of, being a chemical engineer by training, is that it seems that truth is making a comeback, right? Truth, facts, data, database decision making is making a comeback. So I'm encouraged about that, being able to make decisions based on, not just I feel, I believe, but tangible data, facts. I think can only lead to better decisions moving forward. So I'll leave on that note. I think truth is certainly making a comeback, and I welcome it with open arms. So
that's great. Yeah, I agree. That's a good thing. That's a good development. But well, brilliant. Well, thanks so much, Charles. I think that's probably all we have time for right now. And thank you so much for joining me today. Thank you for what you and your team are doing every day, and have been doing for a long time now. I think to our listeners, we hope you'll continue to watch these and listen to these sessions over the coming weeks. All the best for now. Stay safe, stay at home, and wash your hands. Thanks a lot. Talk to you soon.
Thank you,
Bye-bye.